Hello, today I am going to show you the Lisclare Superfine In-Bed System, which will assist the user and end user to move with comfort and safety. The Superfine has been designed specifically for community, nursing home and acute environments. Its key function is to facilitate turning, moving and other transfers within the bed. It is designed to stay in situ. The introduction of the Superfine In-Bed System will assist in maximising comfort and avoiding bed and pressure sores. Superfine material can be placed on top of a pressure-relieving mattress without compromising the effectiveness of the system. Our material is designed to minimise friction and shear, thereby reducing the risk of pressure sores. So in brief, the benefits of the Superfine In-Bed System are that minimal manual handling is required. There is a reduced friction and shear, the patient moving and profiling is made easy, and it has been weight tested for up to 300 kilograms. The Superfine In-Bed System comes in two parts, the top sheet and the bottom sheet. Both are labelled top to show the correct orientation of the sheets. When fitted correctly with the top labels aligned, the satin part of the sheets connect to give us the four-way slide manoeuvre. To transfer your patient onto a bed, first lay the top sheet over the bottom sheet at a 45-degree angle. Lay your patient with their head in line with the top label on the top sheet. Then, gather the top sheet at the shoulders and gently slide them into place. Once the legs are on the bed, you can begin positioning the patient. With the patient in the centre of the bed, they can easily be moved from side to side. To create space on one side of the bed, first put one hand under the patient's ankle and the other behind the knee. Using the hand under the ankle, you can slide the patient's leg across without any friction. Do this again with the other leg. To line up the patient's hips and shoulders with their legs, hold the sheet with your palms face down at the patient's hip, thigh against the bed, and rock back to pull them towards you. Once in line, do the same from their shoulder. Alternatively, you can move both the hips and shoulders at the same time. To reposition the patient up or down the bed, grip the top sheet with your palms face down, close to the patient, and rest your thigh against the bed. To move up the bed, grip the sheet close to the patient's shoulders and face diagonally to the opposite corner. Then rock back with the sheet to make small movements, alternating between sides of the bed to raise the patient's position with a zigzag motion. To move down the bed, grip the sheet close to the patient's hips and follow the same process. This method moves the patient with relative ease. Once they are in the required position, the bed can be profiled. To roll your patient without a hoist, raise your patient's knee to assist if possible. Then, with your palms facing down, gather the sheet at the patient's hips and shoulders with enough sheet to act as a pivot and gently roll the patient over. You can then place a wedge between the two sheets and lay the patient back against it so that you can administer personal care. To roll your patient with a hoist, detach the spreader bar to the integral loops in the sheet at the patient's hip and shoulders. Again, raise your patient's knee to assist if possible. As you raise the bar, your patient will gently roll over. You can then place a wedge between the two sheets and lay the patient back against it so that you can administer personal care. When profiling the bed, the sheet can be used to prevent the patient from sliding, keeping them in a good postural position. To lock the sheet in place, pinch the material at lower hip level and tuck it under itself. After repeating this on the other side, pull the sheet outwards at both ends to flatten out the creases that could cause pressure points. Once the sheet is locked, raise the knee brake and then the backrest to stop the patient from sliding down the bed. The patient is now in a position where they can be safely left. When using the reverse Trendelenburg feature of a bed, we can use the sheet to stop your patient from sliding and keep them in a good postural position. You can use the sheet to reposition your patient if they have a tendency to fall slouched to one side. Simply gather the sheet with your palms face down at the opposite side to where they're slouching. Pull to an upright position and tuck behind the mattress. Your patient will then be locked and no longer be able to slouch. Once the bed has been profiled, untuck the sheet from under your patient. Twist and gather the sheet in your hand and secure it around your patient's shoulder. The sheet's fibres interlock with each other, securing their position on the bed, and they can now be transferred to a chair, stand aid or commode.